Hi, I'm Dr. Surekha Tiwari. I'm a practicing homeopathic doctor in Bangalore for the last 22 years and in this profession for the last 32 years. I'm also a psychological counselor. I have two clinics in Bangalore, one in HSR layout and one in AECS layout. Osteoporosis, if we can divide it into two parts, osteoporous literally means bones have become porous. We all know that the bones have deposition of calcium, right, in a mesh of a lot of fibrous material. Now, calcium mobilization from bones will happen in any condition in which this is not able, if either there is deficiency of calcium, where the body will draw calcium, and one important part before I go forward with osteoporosis is that one mistake which a lot of people do is that they think that calcium is only a part of bones and teeth. Let me tell you, calcium is a very important part of our nervous system. When an impulse has to travel from one nerve to the other, it uses calcium molecules. And that is why people who do not have calcium, this mobilization of calcium will happen through the bones because nervous system will take priority. Also in the cases of feeding mothers, when they are not having enough milk and the child is growing inside them, the child is developing bones. In that case, her calcium will be mobilized towards the child because the child's development will take priority. And then obviously is the state in which we all understand in women who've got menopausal, because that is the time when the calcium metabolic cycle in the body gets disturbed. These are the various reasons why osteoporosis will happen. Now, if we are able to understand these reasons, we can definitely do the remedies, because this much wisdom I know all of you out there have. The osteoporosis is a botheration, right? Because it gives you aches and pains. It gives you weak muscles, it gives you physiological fractures. You get up from the table, putting your hand out, the wrist can break. And people get up from a chair and sometimes they can have a twisted ankle. All these things can be avoided by three things. First, regular amount of exercise. When you exercise, you call your muscles and your bones into play. So automatically the calcium distribution through the bones is never compromised. Especially in women who are menopausal, a little bit of weight training. Because when you use weights, you again cause the bones to get a challenge. It's like an action and a reaction. So when you put the pressure, the bone comes back, bounces back and absorbs calcium. So that's the first thing which you do is regular amount of exercise. The second thing which I've seen very well works is massages. When you massage topically, although we all think that we are just doing a massage on the skin, basically we are actually stimulating the whole structure of the skin right down to the bones. And everything in body is very holistic. All the systems are related to each other. So a massage helps very well in strengthening the muscles, increasing the blood circulation to the various layers of the skin, and eventually the bone also starts feeling the strength because the muscles bears the brunt of the activity. And the third thing is, as we all know, calcium. Now again, having said calcium, in all my practice, I've always believed that natural sources are much better than supplements. If you've got the teeth, if you've got the digestion, then please source it through natural sources. Guavas are an absolute amount. It's a boon to the humankind for having calcium from the vegetarian sources, right? And you would need cheese, paneer, cottage cheese, eggs, everything. If non-veg is what you like about proteins or your calcium, then make it in a simpler form. And milk is not a bad deal at all, as long as you're consuming milk which is good for you in good quantity, which is meaning that for adults not more than 400 ml per day and for children not more than 250 ml per day after the age of 2. If you're doing this much amount of milk on a regular basis, you don't need supplements. And in the last course, if you think that you're lactose intolerant, if you're not able to digest food, if you're not able to chew the guavas, then yes, why not? Then take a supplement. But again, approach a homeopath. Those supplements are milder on the system. They give you calcium absorption techniques. You may be better off.